There's never been a systematic way of consulting patients and carers about research priorities. And so what we were very keen to do is hear the voice of the end user of the research that we would ultimately fund. As a charity who is supporting patients and carers at the end of life, we felt it was particularly important to look at the priorities of these particular groups. So the steering group was made up of funder representatives, but we also looked at what professionals needed to be involved, for instance, from a nursing background, from a medical background, from a social care background. So we had a whole mix of professional expertise on the steering group.
Many different conditions and diseases have been discussed with people with lots of different areas of expertise, from data analysts through to those working in research funding agencies.
They were facilitated by the James Lind Alliance. So Catherine Cowan was the independent chair of the project, and she oversaw the methodology of the James Lind Alliance.
The James Lind Alliance is an initiative. It's a method that was set up to bring the voices of patients, carers and clinicians into research priority setting. We know that patients, carers and clinicians can have very different priorities to those of researchers and of pharmaceutical industries. So the Palliative and End-of-Life Care Partnership is one of the first partnerships that's gone beyond a specific condition and is looking more, I guess, at a setting or at a period of time.
We started by launching a survey to ask people what their questions were, what their unanswered questions were in palliative and end-of-life care. So we had about 1,400 responses to that first survey, which was brilliant. We were really pleased about that. We categorised the feedback in terms of themes.
And we looked at the entire data set, pulled out the interventional questions for further work on the long list and the short list.
And then what we were left with after we did that was 749 PICO questions, so that's questions that fitted the James Lind Alliance methodology. So we whittled those down eventually to 83 questions. Now that we had these 83 questions, this long list of questions that came out of people's open-ended responses from the first survey, we asked people to rank those and tell us which ones were the most important to them. We had just over 1,300 responses, so again that was a really fantastic response from an audience that's quite difficult to engage with, really. We analysed that data, and what we came out with was the top 28 questions that were prioritised most highly by patients, carers and clinicians. And actually there was a lot of overlap between all three of those groups. And then we took the top 28 questions and took those to a workshop.
For me, I think the most interesting and rewarding part of the project was actually the final workshop. So it was extremely exciting to get to that point where we were going to take the questions back out into the public domain and ask people to start discussing them and debating them. But what really stood out for me in that workshop was, firstly, we were dealing with a really sensitive topic and dealing with issues that were not necessarily easy for people to talk about. And I was really humbled by how open they were and how generous they were in sharing their experiences. And I think, secondly, the fact that there wasn't a divide between the patient and carer voice and the healthcare professional voice was remarkable as well.
And so what we ended up with at the end of that workshop was the top 10 highest priority questions in palliative and end-of-life care research. So now we've released these top 10 into the research community, and we're doing a lot of work to embed them and get people excited about them and to try to get some of these questions funded.
It's been exhilarating actually to be part of a group of people who really care about this topic and who wanted to use the work of the partnership to make a positive difference to people's lives.
This project is at the heart of Marie Curie's research strategy. It's the way that we intend to shape where our research is directed over the coming 5 or 6 years.
We are also giving researchers some ammunition, let's call it, to show how important their research is to patients and carers and how important it is that more of this type of research is funded in the UK.
Well, I'm hoping that the results of this project will be very visible to the public
and impact on the health services, social services, voluntary sector, the public as a whole. I think it could have quite a wide-ranging impact. That's what I'm hoping for.
I'm hopeful that over 1,400 people who participated in the project and who sent their thoughts in will feel that they've contributed to setting the research agenda.
This project has already impacted on patients and carers because it's given them the chance to have their say about how they can live at the end of life and how they can die well.